There are weight loss peptides that, for certain goals, may work just as well as the drugs everyone's talking about. And most people have never heard of a single one of them. Right now, if you want to lose weight, you hear the same names on repeat. Ozempic, Wegovy, Tirzepatide, the GLP-1s, the ones used by A-list celebrities, influencers, and probably someone in your own family. But they're not your only option, and depending on what you're actually trying to fix, they may not even be the best one. One of the peptides was designed to target visceral fat specifically, the fat packed around your organs that drives inflammation and metabolic risk, and it has FDA data behind it. Another one works on the fat you already are carrying, helping your body break it down while making it harder to store new fat. And then there's one that goes after the hunger signals themselves, with 2025 research suggesting it may match or even outperform leading GLP-1s for appetite control. So why does almost everyone only talk about GLP-1s? Largely because those are the ones with billion-dollar marketing behind them, not because they're the only things that work. Over the next few minutes, I'll break down 3 of the best non-GLP-1 peptides for weight loss, what each one is, how it actually works in your body, and who it tends to help most. Hi, I'm Dr. Will Haas. I've spent over a decade in integrative medicine, and a big part of my practice is helping patients use peptide therapy safely and effectively. So let's get to it. Let's start with the most overlooked non-GLP-1 peptide in the entire wellness industry. This peptide was designed around fat metabolism itself, especially the way the body breaks down stored fat, which means it was built for people who want to lose stubborn fat while keeping their muscle. And the way it does this makes it even more unique. Here's the strange part. This peptide isn't a whole hormone at all. It's a fragment. Scientists took your body's natural growth hormone, sliced off the last few amino acids, and threw the rest away. Why? Because full growth hormone is a double-edged sword. Yes, it burns fat, but it also spikes your blood sugar and switches on growth signals you don't want firing as an adult. So a lab in Australia did something clever. They kept only the fat-burning tail and deleted everything else. That means it's designed to help fat without messing with your metabolism or causing growth-related side effects like unwanted tissue and cell growth. Things like abnormal enlargement of organs, swelling in certain tissues, or cells multiplying places your body doesn't actually need them. And here's what almost nobody knows. Your natural growth hormone output drops sharply every decade after about 30. That's a big reason fat loss gets harder with age. This peptide was built to mimic just that part of the hormone you actually miss. Unlike GLP-1s, it's not built around making you less hungry. It was built around changing how fat is handled. And in just a second, I'll show you the trial number that made researchers call it the future of fat loss. And it has nothing to do with appetite. In a 12-week randomized clinical trial, participants taking 1 gram per day lost an average of 2.8 kilograms, compared to just 0.8 kilograms in the placebo group. That's more than triple the weight loss on something that doesn't touch your appetite, your hormones, or your muscles. The peptide that does all of this is called AOD 9604, also known as anti-obesity drug. It targets fat metabolism directly through 2 mechanisms. First, it turns on lipolysis. That's your body breaking open fat cells and releasing stored fat so it can be used as energy. Second, it blocks lipogenesis. That's your body making new fat. It slows the process of storing new fat so your body isn't adding it back as easily. So AOD 9064 attacks fat loss from both sides. It burns what's there and blocks what's coming. It was not designed to force weight loss by crushing hunger. It simply helps the body access stored fat more easily, especially when diet, movement, and recovery are already in place. And that's the biggest blind spot, a big one. It can't touch hunger. It does nothing for the part of your brain that screams for a second helping at 9 p.m., which raises the obvious question. If hunger isn't an issue, what about the fat that's actively poisoning you from the inside? The kind that wraps around your organs and inflames your whole body even if you look lean. Because here's the thing that should scare you. You can be normal weight on the scale and still be carrying dangerous levels of this fat. Doctors call it thin on the outside, fat on the inside. The next peptide was built for exactly that, and it's the only one on this list with FDA approval behind it. The fat we're talking about wraps around your liver, your kidneys, your heart. This is what we call visceral fat. And visceral fat is what quietly gives you metabolic disease, insulin resistance, and cardiovascular risk, even when you look fine on the outside. Now, here's where it gets clever. This peptide doesn't add growth hormone to your body, it does something smarter. It sends a message to your brain and tells your own pituitary gland to start producing it again, in the exact rhythm it used when you were 25. Think of it like restarting a factory that's slowed down with age, instead of trucking in products from the outside. And the reason this matters for visceral fat specifically is wild. The fat around your organs is studded with far more growth hormone receptors than the fat under your skin. So when those natural pulses come back, that deep, dangerous fat gets targeted first, almost like it has a bullseye on it. And wait until you see what happened to people's liver fat in the trial, not just their belly. In clinical trials, after just 26 weeks, 69% of people taking it had significant reduction in visceral fat compared to only 33% on placebo. And it went beyond the belly. In a separate trial, the treatment group saw a 31% relative reduction in liver fat, while the placebo group barely moved, which makes this peptide the most important one for visceral fat reduction. And if you haven't guessed it yet, it's Tesamorelin. And unlike other peptides on this list, it has FDA approval and phase 3 clinical trial data behind it. And that's a level of regulatory validation that almost no peptide in this space can claim. But Tesamorelin has one big limitation. It may help reduce visceral fat that's already stored around the organs, but it was not built to stop behaviors and appetite signals that cause that fat to come back. Signals like constant hunger, craving, late night eating, overeating, and feeling unsatisfied even after a full meal. But this next peptide is the first line defense against all those fat gaining signals. So you can finally control them and burn stubborn fat. It goes straight to your brain and shuts down the hunger hormone signal before you ever reach for food. And 2025 research suggests it may outperform every GLP-1 on the market. Here's the part that flips everything. Your body already makes a hormone whose entire job to do is to tell you to stop eating. You're full, and it's called amylin. So if you already have a built-in off switch, why is everyone overeating? Because of a brutal design flaw. That natural off switch survives in your bloodstream for roughly 13 minutes. Then your body destroys it in 13 minutes. By the time the I'm full message is supposed to land, the messenger is already gone. And in people carrying extra weight, the brain stops listening to it altogether. Scientists spent years trying to fix that one flaw. They wanted a version of this signal that would last long enough to actually make a difference. And the peptide they built does exactly that. It copies the same signal and stretches it out for far longer. In a phase 3 trial, people taking it lost an average of 11.8% of their body weight in 68 weeks, which means a 100 kilogram person would lose about 12 kilograms, dropping to roughly 88. This peptide is called Cagrilintide. It works differently in the brainstem, where it activates the same pathways that normally trigger fullness after a meal. Unlike AOD 9064, which works on the fat cell, or Tesamorelin, which works on your pituitary gland, Cagrilintide goes straight to the hunger control center and tells your brain you're done eating. It also slows gastric emptying, meaning food moves through your stomach more slowly so you stay full longer after every meal. And this is what makes it the most powerful peptide on this list. AOD burns fat, but doesn't touch hunger. Tesamorelin targets visceral body fat, but doesn't touch hunger. Cagrilintide hits the hunger problem directly through a completely different pathway than any GLP-1 on our other peptides. But that doesn't mean it's not without its side effects. The most common ones are nausea, vomiting, and constipation, similar to what you'd see with a GLP-1. The good news is they tend to be mild or moderate, and they ease up as your body adjusts, especially when you start at a lower dose and build up slowly. Now, before you go hunting for any of these, I have to tell you the one thing peptide selling websites won't. The single most powerful fat loss intervention I have ever prescribed wasn't a peptide at all. It was telling a patient to go to bed 1 hour earlier. Because here's what most people don't realize. Lose sleep for even a few nights and your hunger hormone climbs while full hunger drops. So you wake up biologically wired to overeat. No willpower failure required. Peptides don't override that. They don't cancel out overeating, poor sleep, high stress, or ultra-processed foods every day. Those habits stay at the same time. The body keeps getting the same signals to store fat. What they do is remove the biological resistance that's been quietly working against you. Sometimes the most powerful intervention isn't a peptide at all. It's going to bed an hour earlier. It's removing the one thing from your diet. It's a basic blood work panel that reveals you've been fighting a losing biological battle because of something you didn't even know about. But if the foundation is solid and you're still hitting a wall, that's where these peptides become genuinely powerful. Combine them with proper sleep, a clean diet, and the right training, and the results multiply. And there's one more reason you can't just order these online, and it's the part that can actually hurt you. These peptides work through real biological mechanisms. Your hormones, your pituitary gland, your brain. Getting the wrong one, the wrong dose, or taking with a pre-existing condition you didn't know about can cause real harm. That could include insulin resistance, severe nausea, joint pain, and in some cases, worsening of underlying conditions like cardiovascular disease or even certain cancers. So, it isn't just like picking a supplement off the shelf. You need a board-certified physician who actually looks at your body before recommending anything. That's exactly how we do it at Vibe Wellness. Before we ever recommend a peptide, we run your blood work. We check your inflammation markers, we look at your full hormonal picture, and then we build an approach that's specific to you, your body, your goals, your health history. Whether that's a peptide protocol, a lifestyle intervention, or a combination of both. You get a plan built around what your body actually needs, not what's trending online. So here's the real question. Which of these three is right for your body? Because the honest answer is, I don't know yet. And neither does anyone selling you peptides off a website. Depends on your blood work, your hormones, and your inflammation markers. It's exactly what we figure out at Vibe Wellness before we recommend anything. If you want to find out which approach actually fits your biology and not what's trending online, book a discovery call using the link in the description, and we'll build it around what your body actually needs.